Welcome to Moving with MS Virtual Support Group. I'm Dr. Gretchen. I'm a physical therapist and a multiple sclerosis certified specialist. I partner with MS Views and News to bring this monthly support group to everyone. And we have a supporter, Viatris, who helps make this happen. So thank you to everyone involved. And thank you for tuning in live and joining us. Today's topic is all about analyzing your walking and different walking patterns that you might have because of multiple sclerosis. And not only that, but what you can do about it. So we're going to be reviewing exercises that you can do based on what style of walking that you have, reviewing reasons of why that might be happening. So it's kind of like a crash course in physical therapy specific for MS, specific to walking. So we're going many levels deep to specificity. So as I mentioned, we're going to be talking about gait abnormalities and really just what is required in order to walk. We're going to analyze why that might be happening and give exercises if that is happening for you, and then briefly discuss some other contributing factors. So my first question for you, if you could type in the chat, is what is the number one thing wrong with your walking? And I hate using that word wrong, but I think it's the easiest to understand what we're talking about. So if you had to say one thing before we get into the specific terminology and whatnot, what would you say the number one thing is that makes your walking challenging, or what would you say is quote unquote wrong with your walking, the most challenging movement? As you likely know, if this is not your first time here at the support group, there's lots of things that go into walking. And I'll do a demonstration in a bit here, but walking is not just one big movement, it's actually 7 individual steps. And all 7 of those things can be challenging, or maybe just 1 or 2, or any of them. And you might not know. As a physical therapist, it is my job to help you determine which one might be impacting you the most. But if you don't know, that's okay too. You can just say, I don't know what it is, just my walking as a whole. I see Kevin says, yes, Florida is MSC's and News backyard. Very true. I always forget that just because we are all so spread out. Carol from South Carolina. Welcome, Carol. Okay, so we have Charles saying balance. I feel off balance all the time. Kathy says drop foot. Yes. Lori says the left leg dragging and motivation to do my PT exercises. Deb says trouble bending the left leg. Yes, and then also dragging the left foot. Julie says walking. Yep. Dion, I don't bend my left knee, so that's 2 now for bending. I hyperextend my left knee. Barbara says I have to lift my right leg with a hip movement. Yep, everything that you guys are saying we're going to be talking about. They do have names for them. Hip and low back pain, and then fatigue with foot drops. Yep. My feet sometimes don't do what I tell them. Yes. I can't lift my right leg because of spasticity. Yep. Not sure the heat makes my leg feel heavy, so that might be spasticity. Heaviness often, not always, but is often spasticity. Balance and drop foot, heavy legs, lots of spasticity, lots of heaviness. My feet need to be in a certain place, yes. Hip swinging and dragging the left foot. Drop foot on both legs, hip abduction and spasticity. Yes, yes, yes. Okay, so all of you are in the right place. We're going to be talking about each of these and why they might be happening and exercises that you can do. So hopefully you feel fully supported. Now we're switching questions here. What is your number one goal for your walking? So we just talked about what makes it hard: difficulty lifting your leg, difficulty bending your knees, spasticity, the heat, drop foot. Do you have a main goal? Just to throw some ideas out there, do you just want to have better quality walking? Do you want to be able to walk longer distances? Do you want to be able to walk faster, walk without tripping, walk without holding on to a mobility aid or your partner? Let's see here. I see Terry says hip flexor is weak and I foot drop. Yep. Carol, I want to go down the steps. Yes, stair climbing, that's walking as well. So I want to go down my steps to leave my house. Awesome. Terry wants to feel balanced on her feet. Marla wants to walk faster and longer. Lori says I need to walk a longer distance and faster to get my driver license back. Kevin wants to walk far enough to maintain cardio health. Awesome. Charles, goal for me is not falling. Yes, sometimes I'm so off balance that falling seems certain. Better quality and endurance. Walk without my walker, walk without devices. Yeah. So with these exercises and consistency, and for some people that means 2 weeks, for some that means 6 months, for some that means a year, but these are going to be the exercises that are most likely to help you reach these goals that you're saying. I want to walk without feeling so exhausted. Yep. I want to run marathons. Haha. Stay ambulatory. More endurance. Awesome. Okay, so let's dive into it. These are the 7 main gait abnormalities that we're going to be discussing today. So I'll demonstrate what they are as well once we're going through each one. But these are the 7 main ones. There's, of course, other ones. One that you don't see on here is knee buckling or knee hyperextension, which one person did mention earlier. We can touch on that at the end if there's time, if there should be. But these are going to be the 7 main ones. And one thing that we want to be asking ourselves is, where is this coming from? Regardless of which of these 7 you may be experiencing, where is it coming from? Hip hike could be coming from a hip issue. It could be coming from your knee. It could be coming from somewhere else. Hip circumduction or hip drop could be hip related. It could be knee related. It could be both. It could be ankle related. So we want to be asking ourselves, is this a hip issue, a knee issue, an ankle issue? Is it balance? Is it all of the above? What is it? Because when you know what might be causing it, we can get so much more specific with what your exercises are so that you start to see improvements quicker, so that you're not just generally exercising to get stronger, but you're exercising the specific areas that are causing your limitations in walking. So walking requires strength, and not only that, but strength in at least 7 different positions. Again, I'll demonstrate this in a second for you. But it also requires balance. It requires muscle flexibility. It requires range of motion in your joints. It requires vision. If you have double vision, blurred vision, vertigo, that can make this challenging. It requires sensation in your feet. If you don't have great sensation, that can cause difficulty walking. It requires speed and it requires endurance. And what we're mostly going to be focusing on today, because we have a limited time and not all day or even all week, which is realistically what it would take, we're going to mostly be focusing on the strengthening and the flexibility components. But as you can see, there's 8 different things that are required for walking. So as I mentioned, we want to figure out, where is this coming from? And as a physical therapist, what we look at is, for strength, we want to see how strong is your hip, how strong is your knee, how strong is your ankle, how strong is your core, just to name a few. But for each of those, it's not just, okay, we do one test for hip strength. We want to test how strong is the front of your hip, the inside of your hip, the outside, and the back. How strong is the front of your knee, the back of your knee, the front of your ankle, the back. So there's many, many details within this. Then we want to move on to balance. Can you balance with both feet on the ground, with your feet apart? Can you balance with them together? Can you do single leg balance on one leg? And you can use a mobility aid, but can you balance on one leg? What about staggered balance? We're looking at all of those components. Flexibility. Do you have flexibility in all of the muscles that attach to your hips, your knees, and your ankle? Range of motion, which is more joint related. It's not muscle. It's, do you have flexibility in your joint? So does your hip joint move freely? Does your knee joint move freely? Does your ankle joint move freely? And then again, we want to look at vision. There's different tests that you can do to see if you do have vertigo or if you have nystagmus. That might sound familiar to you if you do have vision symptoms, double vision, blurred vision, etc. Sensation, there are different tests that we do. Your neurologist would probably be the first person to do this test, but they can test your sensation with your eyes closed. There's these, they're called filaments. They're basically, how do I want to describe them? oh my gosh, I'm losing a word. It's kind of like a pen. It's not a pen, but it's kind of like this. And there's a bunch of different ones that each have a different level of thickness at the end. The thinner ones are super, super thin. Those are going to be harder to feel, whereas the thicker ones, like a pen, is much easier to feel. And so your neurologist will often put the thickest one on your foot, maybe in a few different areas, just see what your sensation is like. And then they'll grab the next thinnest one and then the next thinnest, and you work your way down to see, are you able to feel that? There's other types of sensation as well. There's hot versus cold. If you have numbness, tingling, where is that stemming from? Is it stemming from tight muscles or a pinched nerve? Again, speed and endurance, we want to be looking at those during our analysis as well. So all this to say that when you go to a physical therapist, we are looking at a lot of things. And the reason for that is, again, to determine, if possible, which specific areas are most likely causing you to walk the way that you're walking. So let's dive into it. We're going to start with hip hike. Here's what we're going to do moving forward. So I'm going to read the slide to you, and then we're going to do some demonstrations. So I'll stop sharing my slides, and then we'll come back and move to the next one. So hip hiking, that is when you hike up one hip, and at least one person mentioned this in the comments that you have this. So why is this happening? More often than not, the hip hike is happening because you can't lift your leg. Maybe hip flexors are really weak, and or you have difficulty bending your knee, which are your knee flexors, and or you have difficulty lifting your ankle, which means the muscles on the front of your ankle could be weak, or the muscles on the back of your ankle could be tight. So therefore, what we would want to do is strengthen our hip flexors, because we mentioned up here hip flexor weakness. So we can strengthen our hip flexors. We also said weakness in our knee flexors, so we could strengthen our knee flexors via knee bending. And then if it's an ankle issue, we would want to strengthen our ankles, but also stretch the opposing muscles. So if you have weakness in a muscle group, more often than not, you might have tightness on the opposite side. So I'm going to stop sharing my screen just so we can start practicing and you can hopefully piece together what I'm talking about. Hip hike, and watch this leg. So hip hike, and I'm really exaggerating. You might have any of these different gait analysis for your walking. I'm going to really exaggerate just so you can really tell what we're talking about. You might not have it to this extreme, but that's okay. So hip hike, if you're watching this leg, is when this hip hikes up and then comes down. So instead of bending your knee to bring your leg forward, it comes up. Instead of this, it does this. And again, one reason for that could be your hip isn't bending. If your hip doesn't bend, then this is a great way. You'll see from this side, my hip doesn't have to bend at all. It's staying straight. So that's a way that your body can overcompensate. Similarly, if you can't bend your knee, then look what happens. When I hike my hip, my knee doesn't have to bend at all. So the reason that you might be hiking your hip could be due to difficulty or weakness bending your knee. And then the last one, foot drop. If you have weak muscles, so lifting your ankle here, if you can't lift your ankle or bend your knee, then the only way to get your leg up and forward without scuffing the ground excessively is to hike your hip, or our next one, which is circumduct, bringing it around. So with that said, let's talk exercises. If one reason that's happening for you is due to difficulty lifting your leg, then you want to practice lifting your leg. Find a position where it's easiest for you. Maybe it's seated and reclined, and you practice lifting. I always like to practice both sides. Maybe it's standing with or without a mobility aid, practicing lifting. So any form of marching. The next one was knee bend. So you could practice, actually, this is a really good exercise, bending your knee, pulling yourself forward. That's a good exercise for hamstrings. It also could be practicing pulling your leg back like this in a seated position. It could be standing and bending your knee, and I'm exaggerating right now, but some variation of this. So those are the first two categories. And then I mentioned we would want to stretch opposing muscles. What I mean by that is if our hip flexors are really weak, sometimes the muscles on the opposite side, in this case our backside, could be really tight. So doing some stretches like a hamstring stretch or a figure 4 stretch could be really useful in releasing tight muscles. Similarly, if bending your knee is hard, if there's weakness here, there might be tightness here. So we could massage these muscles out or do a standing stretch to try to stretch those quad muscles. The last thing that I had on that slide there was practicing balance. The reason we like to talk about that is because if you are hip hiking, you need to have a good amount of balance on this leg in order for you not to wobble and fall over. So practicing balance on this side so that you are at least safe while you are bringing your leg through. So again, you can use a mobility aid and just practice how long can you stand on one leg safely, and then put that other foot back down and safe and back down. So that is the first one. That is what hip hiking is and the muscles that we're looking at. Okay. Next up, actually, let me see what questions you guys have put in the chat. Yes, have more stability walking, walk longer would be great. Sounds like modified safety pin. It's kind of like that, but it's not a safety pin. It's not something that would actually prick you. Yes, this is me, but I use my walker and my body to lift my hip. Yep, same thing. My right leg will not bend for marching. That's okay. So if you have a lot of spasticity in your quad muscles on the top of your thigh, then likely when you march, your knee won't bend. Either at all or as much as you think it should be, but that's okay. The marching exercise is primarily to strengthen the hip flexors, not the knee. So we're mostly just looking at how high you can lift the leg, not necessarily is your knee bending as well. I recently purchased a vibration plate. Is this something you see beneficial? I have not used a vibration plate. I have heard that they can be beneficial. When it comes to balance, there's research showing that the vibration plate setting that goes up and down would be the most beneficial versus like the side to side or up and back circles. Like the up and down is what's going to be best. I still have elbow bursitis, so I get discouraged a lot. Yeah, it's really important to have this discussion that we're talking about for mobility and walking, because if you're using a mobility aid too heavily, it often leads to bursitis or injuries in your shoulder, your elbow, and or your wrist. And it's one thing that I hate to see, because if you're putting a lot of weight through your mobility aid, it can lead to that injury. And then if you have an injury, you can't put that much weight through that mobility aid, and therefore you might be sitting a whole lot more than usual because you can't move around as much. So it's just a downward spiral. So knowing these now is better late than never. You know, the sooner the better. It's never too late to start either with these exercises. Okay, so the next one is hip drop. Now, and this is actually the opposite of what we just did. We just did hip hike. Hip drop is another really common one. The most common reason this happens is due to gluteal or outer hip weakness, not just weak hip flexors. And more often than not, it's actually the opposite side that you would assume is weak. For example, if your right hip is dropping, it often means your left hip is the weaker hip. So what do we want to do? Strengthen the gluteal muscles. So again, stretch the opposing muscle, and then practicing balance on both sides. So I'm going to stop sharing my slides and we will review this together. Hip drop. Oh, okay. So if we watch this leg again, hip drop is when this leg should be moving forward, it drops. So this hip is dropping. So it might look something like this. And again, I'm really exaggerating, but if it sways to one side, this hip is falling down. If you had your hands on your hip bones and they're facing forward like headlights, you'd have one that's skewed downward because it's dropping. And as I mentioned, this leg dropping has everything to do with weakness in this hip. This hip is not strong enough to stay pushed in and get your hips back to neutral. So when the right hip is dropping, more often than not, it's the left glutes that we want to strengthen. So that could be an exercise like the clamshell, which I'll show you in a second, or even standing side leg kicks. So I'm kind of going diagonally back. The goal is to strengthen this glute muscle. I also mentioned on that slide balancing on both legs. So can you shift your weight onto this leg without that hip dropping and this one poking out? If not, don't put that much weight through. So maybe only put this much weight through and then back off. So it's all about strengthening this hip, trying to get it strong enough to stay in place so that this leg can move without dropping. And then for the seated clamshell exercise, that's where your feet are together, toes are touching, feet are touching. You're going to open and close. And from the front, it looks like this, opening your knees as wide as you can, squeeze your glutes, and then relax and close. Open, squeeze, relax and close. So that can be a great hip strengthener as well. I mentioned stretching the opposing muscles. So our opposite muscles from the outside of our hips are the inside of our hips. So that might be an inner thigh stretch like this. And you can turn one way. When I turn to my left, I'm stretching more of the inside right. When I turn to my right, I'm stretching more of my inside left. Or you could just stay forward if that feels best for you. So that is for the hip drop. All right, the next one, several of you mentioned this earlier, is hip swing or circumduction, which is when your leg swings around to the outside. The most common causes for this are very similar, if not identical, to the first one of hip hiking. So why might you be swinging your leg around? If you have knee weakness, aka you can't bend your knee, or if you have weak hip flexors, aka you can't lift your leg very well, or if you can't lift your ankle or therefore you have ankle tightness or weakness. So exercises are going to be the same. We want to strengthen the knee bending, strengthen the marching, stretch the opposing muscles, and balance on both sides. So let's show what that would look like for hip swinging and circumduction. So hip swing, again, we're going to focus on this side, and I'm going to really exaggerate, but hip swing is this. So instead of your leg coming through, it swings around to the outside. That's circumduction. So again, walking, you're kind of swinging your leg around. Oftentimes your knees staying straight. And the reasons are very similar to the hip hiking. If you can't bend your knee, the only ways you can get that leg forward typically is to hike or swing. So we want to focus on strengthening those muscles to bend your hip, lift your leg. Again, I demonstrated last time you can do them standing, you can do them seated and reclined backwards, whatever works for you. Even if it only moves a centimeter, that's fine. If you can't bend your knee, the only way to get your leg forward, again, is either that hip hike or swing around. So we want to practice bending your knee, even if it looks like this. That's great. You're still using your knee. Practice bending that knee. That's standing. You could do the seated option that I demonstrated earlier. You could be lying on your back and bend your knee and then straighten. Whatever works for you, but practice bending that knee. And then lastly, if you can't lift your ankle and therefore it's just going to keep scuffing the ground the whole way, oftentimes that leads to hip hike or swinging, because when I swing my leg around, I don't have to use my ankle at all. It can stay floppy the whole time. So we want to practice lifting our ankle, both sides, but the side that you are noticing that symptom on is going to be your priority side, I would say. And then for stretching the opposing muscles, same idea as the last time we discussed this. We had said the figure 4 or hamstring could stretch the back side. The massage for the quads, or some type of hip flexor quad stretch for up here. A calf muscle stretch with putting a cane or something, a strap around your heel and leaning forward to stretch your calf. Or the standing version would be this, where your heel stays down and you're staying, stretching that calf. So, and then again, practicing balance, like I mentioned, for the hip hike is also going to be really important for the hip circumduction as well. Especially because hip circumduction can really throw you off balance because you're swinging a leg around. So you want to make sure that you're feeling steady on your feet. The better balance you have, the less likely you are to be thrown off balance from that leg swing. I see someone says, one of the challenges I have with walking is that I take shorter steps because I'm afraid of falling and spasticity. Will these exercises or stretching help improve my stride length? Not if you don't combine these with practicing stride length. These can help with stride length if you are also practicing taking bigger steps. If you miss that step, then oftentimes it will not result in improved stride length, because something like stride length is occurring oftentimes due to weakness and tightness, which is what these exercises will help with, but also, as you mentioned, habit and fear. So if you are still fearful of taking bigger steps, then you can do all the exercises in the world and it's not going to help you take a bigger step length. Or even if you don't feel as fearful, if it's a habit, if you've been walking that way for years and you don't practice walking in a different way, you'll just keep walking in that way. So practicing walking with bigger strides, even just slightly bigger, can be really helpful. Is back of my right knee is very painful. I can bend it, but the back of it hurts a lot. So that could be a bunch of different things. There could be orthopedic reasons that is happening, such as if you have bursitis in the back of your knee. Is it just your hamstring muscles firing so hard and that's why it's hurting? Is there something else going on? So if it's been that way for a while, you might want to get that checked out. Even just from an orthopedic physical therapist could work. But yeah, hard to say why. Not that you asked why, but I'm assuming your question was why. Hard to say just through this type of atmosphere, this way of working together. Okay, let's go back. The next one is foot drop, foot slap, foot drag, drop foot, toe scuffing, anything related to your foot. Oftentimes it's due to weakness in one muscle and or tightness in another muscle. And most times it's weakness in the muscles on the front of your ankle and tightness on the back of your ankle, so your calf muscles. So generally speaking, we want to strengthen the front of the ankle, stretch the back of the lower leg and ankle, and then of course, one you'll see all the time, balance on both sides. So let's talk about it. foot drop, foot drag, foot slap, drop foot, toe scuff. All of these can manifest so differently, but it's some variation. If you watch this leg, it's some variation of maybe dragging your toes like this, or maybe you are able to lift it, but you drag it closer towards the end of your gait cycle with that step. Maybe you're landing on your toes instead of your heel. You're landing on your toes. Foot slap is when you do land on your heel, but you can hear yourself walking because you just have that slap with every step, so you can hear it. So any variation of that is often due to ankle weakness and tightness. So we would strengthen, we've already done this one, but strengthen that front of your ankle. Straightening your leg a bit like this compared to this can make it easier. And then stretching the back of your leg. So again, I usually like to use a strap or something to pull my toes and then lean forward, or this stretch where your leg is behind you, heel stays down. That can be a good stretch for the back of your calf and ankle as well. The other thing that I want to mention, this doesn't necessarily specifically relate to foot drop or foot slap, but it is if you land on your ankle. This is a very common one as well, where you might be landing on the outside of your ankle or outside of your foot and then come forward, in which case we really want to strengthen the muscles on the outside of our leg so that it doesn't fall down, it stays straight. And my favorite exercise for that is called ankle eversion. So it would be like this. So it's a very small movement, but you're trying to scoot just the forefoot, not your whole foot, just the forefoot out. And or another way that you can think about it is try to pick the pinky side of your foot up without your knee caving inward excessively. So those are the exercises that might be best for ankle-related symptoms. Terry says maybe torn meniscus of why it hurts behind the knee. Yeah, torn meniscus, or even not a full tear, but like some mini tears might be if there's so many orthopedic reasons of why pain could be behind the knee. I see that throw rug and I immediately think of danger fall. Absolutely, it is definitely danger fall. I personally, and I don't have foot drop, and I have tripped over it many of times. Even when I'm rolling with my chair gets caught up on it. Walking like you're drunk, which no one said this. I'm curious if you experience this, let me know in the chat. No one said it earlier, but it's a pretty common one, which is why I wanted to talk about it today. Okay. So walking like you're drunk, you might feel this if you have unstable walking or unstable gait or wobbly gait or scissor gait. Scissor gait is when, and I'll demonstrate this, but it's when instead of keeping your feet out nice at like your normal width, you cross one in front of the other. So you're kind of going one side to the other. Oftentimes, the walking like you're drunk can happen if you are too unstable on one leg, even with a mobility aid, and or poor proprioception, which I'll explain when we're doing it. So the best exercises often is balance and practicing foot placement. So let's take a look at what this one looks like. Yeah, I see some people in the chat saying, yes, that's me. There's an MS joke I tell on myself about drunk walking. Yeah, absolutely. Okay, so walking like you're drunk. It can look many ways. Again, please don't feel like I'm demonstrating all the ways. This is just some of the ways. But walking like you're drunk, it can look like the scissor gait that I mentioned, where instead of you put your leg here and here, and you're keeping your legs at your hip width apart, you're crossing like this, something like this. You might cross one leg, but not the other leg, and then you're kind of veering over this way or this way. It could be that your leg just doesn't land where you want it to. You meant for it to land here, but it actually landed over here. And then you try to correct your walking and it throws you off. And so your leg is just going to land wherever it can land. And one reason for that is poor proprioception, which means poor foot placement, or it can be for the upper body as well. But in this case, poor foot placement. So you meant for your leg to go here, but it actually went here or here. And one of the best exercises for this is to practice foot placement. So this actually, we were just talking negatively about this carpet, but in this case, I see a blue speck right here. So a great exercise could be practice lifting my leg and tap my heel to that blue speck and then take it off. And you could do this with a mobility aid, but you're practicing touching a specific place, not just anywhere, not just, okay, let me put my leg forward, a specific point. The other reason this could be happening is due to poor balance on this leg or both legs. But if it takes me, especially if I'm walking slower, let's say it takes me a solid 3 seconds to slowly bring my leg forward. Regardless, maybe I have the circumduction, maybe I have the hip hiking, whatever it is. If it takes me 3 seconds to bring that leg forward, and I can't balance on this leg for 3 seconds, if I can only balance for 2 seconds, then this leg is going to land wherever it can. It just needs to go down to help me balance. So it's going to land wherever. So the more we practice balancing on one leg, with or without a mobility aid, the better this can get. Additionally, the more we practice weight shifting. So weight shifting is a type of balance. It's called dynamic balance. Can you keep your balance on that leg while shifting your weight forward or backwards? So these are the exercises you'd want to be thinking about if you have that gait analysis. How do we correct scissor gait? Yeah. Another thing with scissor gait, that clamshell exercise or the side leg kick that we mentioned earlier could be a good one, combined with stretching the inside of your thighs. So that stretch that we did earlier where our feet were wide and we leaned forward. Sometimes scissor gait can occur due to tightness on the inner thighs. So we'd want to stretch those inner thighs, and weakness on the outer hips. So that's when you'd want to do that clamshell exercise. I drunk walk sometimes when I am fatigued. Yeah, you are not alone in that. We have someone else that says, I started working with a pelvic therapist since PT didn't make much of a difference. After 9 months, twice weekly visits, I feel an electric shock down my left leg with the first 10 steps from sitting to walking. Then mostly fine unless turning a corner while walking or rotating in the bed at bedtime. Then it catches again for several seconds. Pelvic therapist found floor spasms. New to me since it seems so deep. I can't feel it. But our pelvic floor is so closely related to our mobility. It's so closely related to our hip muscles and our core muscles. And if our pelvic floor is out of sync, our balance, our mobility can be out of sync as well. So yeah, I'm not surprised to hear that. I'm glad that I think everyone should work with a pelvic floor specialized physical therapist, even if it's just once to get evaluated. Pelvic floor is so important and it's not talked about enough. Is scissor gait more prevalent when using a rollator? I haven't seen that to be true. Maybe if someone using a rollator, if they're fearful of hitting the wheels, then maybe that would cause scissor gait, but I haven't seen that to be true. Okay, so other contributing factors, as we've talked about earlier, sensation. If you can't feel your feet, then you likely can't sense the ground. And I don't mean if you can't feel your feet at all. Let me rephrase that. If you have decreased sensation in your feet, then it's going to be harder to feel the ground, and you might not really know if your heel is hitting first or if you're hitting with a flat foot or your toes. If you have burning in your feet, that can make sensation challenging. We need to be able to feel our feet and feel the ground in order to get that, what's the word I'm looking for? Get that message from our feet to our brain. With every step, the muscles and tendons and nerves in our feet are communicating with our brain and telling us, oh, you stepped too far inside, let's correct that next time. Or, oh, you just tripped on your toes, or, this is what happened, let's correct that. They're talking to each other if you can feel the ground. If you can't feel the ground as well as what is normal for you, that's going to impact those signals. Speed is another contributing factor. Sometimes our goal is to walk faster, but if you have spasticity, walking faster often makes spasticity worse. So we kind of want to prioritize what the main goal is. And then endurance, meaning how long can you walk? How many minutes, how many feet, how many yards can you walk? All of these things are other contributing factors. Another thing, heat and cold intolerance. Someone mentioned earlier, if they get hot, then their walking is worse. Absolutely. If you have heat intolerance, any change in your core temperature that is over 1/4 of a degree could make your symptoms worse. If you have cold intolerance, any change of a decrease by 1/4 of a degree can make your temperature, or it can make your symptoms worse. Fatigue is another one. If you are feeling fatigued, that can make any of these symptoms worse. Pain, of course, if someone, I forgot who it was, mentioned the pain behind your knee. If you have pain behind your knee, specifically when you bend your knee, then your body is not going to want you to bend your knee. And so it's going to find other solutions for you so that you can avoid that pain. Other injuries or other comorbidities also can contribute to how you are walking. So here's some helpful tools. AFOs, or also known as ankle-foot orthoses, or ankle-foot orthosis, these are often carbon fiber. Very rarely are they plastic, but think plastic carbon fiber that has a foot plate that you put in your shoes, and then also a plate that comes up either the back of your calf, the outside of your calf, inside or front of your lower leg. There's a bunch of different variations. And the goal is to prevent foot drop by preventing your ankle from dropping. On the contrary, braces like the Dictus band, the Elevate 360, the foot up, those are ankle braces that have attachments to the eyelets of your shoe via a rubber band or strings of some sort. Those work by preventing foot drop by assisting in lifting your ankle. So big difference between AFO and brace. Sensation, I really love this company called Naboso. They have, sometimes I have a product sitting out, but I don't. They have products like shoe inserts that have a specific texture on them. It looks like tiny little pyramids, and that texture can help you feel your feet more. And as we've been talking about, if you can feel your feet more, those signals will be talking to your brain better, and it can help you walk better because you can feel where your feet are in space. Shoes, I'm currently wearing Kizik. I pretty much only wear Kizik now. Kizik shoes, I'm going back up. By the way, I'm not like a advocate, like a brand ambassador or anything for any of these brands. I just wanted you to know. So Kizik, I really like if you lose your balance easily, or you just can't, maybe you don't have hand strength to put shoes on. Kizik are hands-free shoes. So you can step out of them and step in and then go. So I really like Kizik shoes. You can even do it standing as well. It just makes putting shoes on much easier. Another brand of shoes that I like are Cadence. Cadence shoes are sneakers that have pucks, like nylon pucks on the bottom that allow you to slide your foot forward because the pucks are slippery. The only thing I'll say about Cadence is that those are great shoes to, if you have foot drop, it can help you walk with foot drop safely, but you must combine them with these exercises that we talked about today. Because if you don't, then they're not a solution for improving your foot drop. They are a solution for walking with foot drop just more safely, because hopefully you won't scuff your feet as much because it will help you slide. So if you're looking to reduce your foot drop and improve it, you must combine it with exercise. And then mobility aids is the last one that I have here. And this could be anything. It could be a rollator, it could be a cane, it could be trekking poles, it could be a wheelchair, any mobility aid. And I love a variety, especially if your mobility changes day to day based on the temperature outside, based on your fatigues, your sensation, whatever it might be. If you're able to, have several and just pick what you need for that day. Okay, let me see if there's any other questions. Oh, I do see some questions in the chat. So I will go back to the chat. These are the ways that you can reach me. My website and ways to work with me is at missinglink.com. I have a podcast called The Missing Link. I have an Instagram and Facebook page as well for social media with short videos, and then YouTube is more for longer videos for mostly exercise, physical therapy type stuff, but also symptom management for MS as well. Can you review can you review proprioception? So proprioception is it often goes hand in hand with a term called kinesthesia, and it essentially means difficulty with foot placement. So you attempt to put your foot here, but it actually falls over here. And it's a nerve thing, and we would need to retrain that neural pathway to go where you want your foot to go via that stepping exercise where you have something on the ground. It could be a hair tie, it could be, it could have a little bit of a height to it like chapstick, and you try to tap your heel to that specific item to work on foot placement. Stress is a huge contributing factor to all my symptoms. Yes, you are not alone in that. Stress can make any symptom worse. And the thing that's tricky about stress is it's different for each person. For some people, you need to be under extreme stress in order for it to affect your symptoms. For other people, even just mild stress can affect your symptoms. So it's a good idea to have something that works for you to help reduce your stress, whether it's a breathing exercise, coloring in a coloring book, visualization, something to help lower your stress, not even get rid of it, but just lower. Proprioception is often called the body's sixth sense, is the awareness of your body's position and movement in space. Yes, exactly. So like the awareness of where your leg is. And again, as I mentioned earlier, it's for your arms too. It's like if I have my eyes closed, can I tell that my arm is forward right now? Or can I tell that my leg is forward right now? Can I tell where my body or limb is in space? Yeah, good job. My nose is so itchy right now. I don't know what's going on. I've gone through all of what you just described, and now I'm using Bioness. Yeah, Bioness. So one thing I didn't mention on my helpful tools is electrical stimulation. There's lots of different tools available now for electrical stimulation, like the Bioness, the Walk Aid, the Newbie, the Psionic Sleeve, Pons. There's lots of different options right now, but electrical stimulation could be something that you use to help with foot drop, and in some of those cases, knee bending. Knee kissing. Yeah, so for knee kissing, that tends to be tight, similar to scissor gait. So as we talked with scissor gait, it's one leg coming in. Knee kissing is when your knees come in. So it's not your whole gait, it's just your knees can collapse inward. So that can happen due to tightness on the inside of your thighs. So we'd want to do that stretching exercise, and weakness in the outer thighs. So the clamshell or that standing side leg kick. can be helpful as well. Insurance provides only one mobility aid per 5 years, so I would have them cover the cost, cover the most expensive one. Yeah, great point, Lori, absolutely. What happens when the meds affect balance? Yeah, if your medications are affecting your balance, if you haven't already, talk to your neurologist or a, oh my gosh, oh my gosh, I'm forgetting, psychiatrist, I think is the one who will look at your medications and help you determine what the best combination might be if you're getting negative symptoms from the combination or one of them. What exercises can be done to prevent landing scuffing on the left big toe? So kind of the opposite of the ankle eversion. So earlier I mentioned the ankle lifting, but if you land on the outside of your foot, I mentioned attempting to move your foot slightly to the outside or even lifting the outside of your foot would be a good exercise. But if it's the opposite for you and you're landing on your big toe, it would be the opposite exercise. So you're going to try to move your foot in slightly or lift your big toe up slightly. Again, not so much that your whole leg rolls out, but just looking down, can you lift the inside of your foot? Those blinking lights help exercise for the foot placement. Yeah. What are you referring to? Is it called Blaze Pods? There's a couple different companies, but yeah, you can get really creative with these exercises for sure and use like fun tools, make them game-like. Yeah. After exercising, my pain level goes up significantly, especially at night, to the point of tears, and that kills my motivation to keep up. Any suggestions? Yeah. So what I would do is, if you haven't already, write down what you did. And with MS, it's probably something different every time, but what did you do that caused that level of pain? And then whenever you can exercise again, do less. So that could mean if you did 7 exercises, then maybe you only do 6, or maybe you do 5 or 4, just do fewer exercises. Or if you did 7 exercises and you did 2 rounds of each of them, maybe just do 1 round of each of them. Or if you didn't really take rest breaks, take rest breaks or take longer rest breaks. So there's lots of different ways, but take it down a notch in some way and then analyze, did you feel the same way? If so, next time you exercise, take it down another notch. Try a different way to modify. How did you feel? It's a lot of trial and error. So making those changes and then trying it out. Did it help? Did it not help? Where are we at? So that's usually the best way to try to find what works for you. And the last thing I'll say about this is just encouraging you or reminding you that all movement is exercise. So often, a lot of us, myself included, who are type A, we feel like we have to go big or go home, go hard, make sure we feel like we put in a lot of effort. But with MS, sometimes that's not good. That's going to make you flare. And if that's true for you, remember that any movement counts as exercise and can help with your mobility. You don't need to exercise for an hour to make that happen, or even 30 minutes. For some people, exercising throughout the day, 5 reps here, 10 reps there, sprinkled throughout the day is better. And research shows that that's just as effective. So finding something that works for you. Yes, my PT used Blaze Pods with me. Yeah, Blaze Pods were for helping my foot depress an accelerator. Yes, in the car. Yeah, those are fun. Do you have these exercises on your YouTube channel? I do. They are spread out. I have an online program called The Missing Link where they are all listed on a calendar where it says like day 1, do these exercises, day 2, do these exercises, and there's videos for each one. So they are on my YouTube channel spread out between a bunch of different videos. It's not as nicely as organized as in The Missing Link, but you should be able to find them somewhere on there. All right, and that was the last question, and we have 1 minute to spare. We are good to go. One other one came in. My first 2 years of PT was learning to stop sooner and not push myself. Yeah, it can be really hard because more often than not, your body won't tell you that you should stop. you'll only know later when your body's like, hey, you should have stopped. I'm in tears right now. That was too much for me. So it really is stopping before you feel like you need to. And that is hard to do. All right, I see Charles says thank you. Emily says thank you. Very helpful. Good. I'm so glad. Dion, Lori, Pam, all saying thank you. Good. I'm so glad. I love doing these with you guys. And I really appreciate your participation, you letting me know what your struggles are. And it just helps me fine tune these talks to be specifically for what you're going through and what you need. So thank you for your participation and for showing up today. Yes, someone said, Lori says, unfortunately, sometimes falling into the front doorway is my warning. Yeah, oftentimes the warning is not while you're exercising, it's later. So it's a tough one to stop before you feel like you need to, but it's a good thing to practice. Awesome. All right. Well, thanks again for tuning in. Thank you again to MS Views and News for partnering with me to bring this to you guys, as well as our supporter Viatris, again, for making this all happen. It's very much appreciated. So thanks, everyone, and I will see you next month. Have a good rest of your day.